Blame attribution and compliance with COVID-19 measures in Australia. The theory of planned behavior, which was recently published by COVID Journal 2025. This research was co-authored by Dr. Hyujin Shi and Dr. Dashi Zhang. This study scrutinized the influence of blame attribution and the theory behavior on compliance with COVID-19 public health measures in Australia. This study elucidated that blaming individuals rather than governments surprisingly augments support for governmental regulations, highlighting the complexity of blame attribution in shaping public adherence to health policies. It underscores the nuisance roles of TPB's elements like subjective norms and behavior control, revealing that feeling of empowerment, social responsibility, recognizing personal roles in pandemic control enhanced the inclination to support governmental directives. The outcome emphasized the criticality of understanding blame attribution and the TPB dynamics for devising efficient communication and management strategies, promoting societal adherence to essential regulations and actions during health crisis, and fostering a more resilient societal infrastructure for the dealing with the COVID-19 pandemic in late 2019 significantly impacted global health, economy, and social practice. By June 2020, there were over 7,700 confirmed cases in Australia. The TPB is widely recognized for its utility in predicting and understanding health-related behaviors. TPB serves as a guiding framework to examine Australians' attitudes and behavior intention towards COVID-19 policies. This study aims to fill a critical gap by analyzing Australian attitudes and behaviors towards COVID-19 policies in Australia. It focuses on blame attribution to China and its influence on compliance. The literary review focuses on how blame attribution during COVID-19 shapes public sentiment and the emotional responses. I reviewed the literature regarding the impact of blame attribution and political factors on COVID-19 responses, TPB theory, and COVID-19, an examination of behavior intentions and compliance, role of TPB in attitude response to COVID-19, integrating TPB, analyzing public attitudes during COVID-19 crisis, the role of emotion in shaping public attitude and behaviors amid COVID-19, blame attribution factors in crisis communication, blame on Chinese government, blame on Australian government, and blame on individuals. We have proposed the hypothesis H1, blame attribution categorized as blame on Chinese government, blame on Australian government, blame on individuals will significantly influence the level of negative attitudes toward COVID-19. Blame attribution categorized blame on Chinese government, blame on Australian government, blame on individuals will significantly influence reactive attitude towards the adoption of COVID-19 preventive measures. Hypothesis 3. A theory of planned behavior elements such as subjective norms and motivation to comply will increase the level of negative attitudes toward the coronavirus, while behavior control will not. Hypothesis 4. According to the theory of planned behavior, elements such as subjective norms, motivation to comply, and behavior control will increase the level of reactive attitudes toward implementing COVID-19 preventive measures. Hypothesis 5. Negative attitude toward the coronavirus will increase behavior intentions for self-protection measures. Negative attitude toward the coronavirus will enhance support for the implementation of governmental regulations. Reactive attitude toward the adoption of COVID-19 preventive measures will decrease behavior intentions for self-protection measures. Reactive attitude towards the adoption of COVID-19 preventive measures will discourage support for the implementation of governmental regulations. Hypothesis 9. 1. Blame attribution factors include blame on the Chinese government, blame on the Australian government, and blame on individuals will impact the level of behavior intentions for self-protection measures. Blame attribution factors blame attribution factors, including blame on Chinese government, blame on Australian government, and blame on individuals will impact the level of support for the enforcement of governmental regulation. Hypothesis 10. 1. Element of theory of planned behavior such as subjective norm, motivation to comply, and behavior control will impact the level of behavior intention of self-protection measures. Element theory of planned behavior such as subjective norm, motivation to comply, and behavior control will impact the level of support for the enforcement of government regulations. This is our theoretical model and hypothesis. Please have a look. A national online survey was conducted with 1,101 Australian residents using Qualtrics for data analysis and analysis. For the result, hypothesis 1 ABC was supported, hypothesis 2 ABC was supported, hypothesis 3A and hypothesis 3B was supported, while hypothesis 3C were not supported. Hypothesis 4A and hypothesis 4C were supported, while hypothesis 4B was not supported. Hypothesis 5, hypothesis 6 were confirmed, hypothesis 7, hypothesis 8 were confirmed. Hypothesis 9(1)A and hypothesis 9(1)B were confirmed, but in a different direction, but hypothesis 9(1)C was not. Hypothesis 9(2)A, hypothesis 9(2)B were rejected, while only hypothesis 9(2)C were confirmed. Hypothesis 10(1)A, hypothesis 10(1)B, and hypothesis 10(1)C were supported. These results confirm that variables SN, MC, and BC influence support for government regulation supporting hypothesis 10(2)A, hypothesis 10(2)B, and hypothesis 10(2)C. Please have a look. This is table. Regression analysis of blame attribution types and emotional outcomes. Please have a look. Table 2. Regression analysis of measured variables on behavior intention towards corona-related policy. Please have a look. The role of political factors in shaping COVID-19 related attitudes and behaviors. The confirmation of the theory of planned behavior in terms of its impact on behavior change. Our study examined how TPP elements, subjective norms, motivation to comply, and behavior control impact intentions for self-protection and support for government regulations. During the COVID-19 pandemic, for self-protection measures, all TPP components showed significant positive effect. SN, MC, AR, and BC each had a robust influence, suggesting individuals with greater influence perception, higher compliance motivation, and stronger behavior control are more inclined to adopt self-protective measures. This is consistent with previous research on TPP. Understanding blame attribution and TPP dynamics crucial for devising effective communication and managing strategy during the health crisis. Subjective norms indicate self-driven action, while motivation to comply suggests reliance on societal norms, potentially hindering effective communication for government measures. These insights are crucial for health campaign message and policy development, especially in addressing behavior control. This is our reference, some of our reference. Thank you.